Being overweight can adversely affect your health in many ways. Those extra pounds increase your risk for heart disease and diabetes, stroke, osteoporosis, and many other serious illnesses. If you are not having any luck in losing the extra pounds, bariatric surgery may be for you. And joining me this morning with more is Dr. Patricia Choban. She's Program Director for the Mount Carmel Bariatric Center. Welcome, Doctor. Nice to have you here.
Thank you.
Explain what bariatric surgery is. I think some people might figure out a little bit, but they really don't know the details or understand.
The bariatric surgery is an abdominal operation, and we actually have three choices in the current age, which takes patients who are extremely obese, 100 pounds or more overweight, where their weight is really a health threat, and gives them another tool so that when they begin to do all those things they've been told to do, eat healthy, exercise, it now actually works.
And so this is really for folks who are obese, not just somebody who wants to lose 30 to 40 pounds. You really have to be off that scale in a way.
Correct, where the health threat from the weight exceeds the health threat from surgery. Any operation has some risk, but it turns out being that overweight is more of a risk.
We have some examples of three types of surgeries that you perform. First, we're going to show what is a general picture of what the anatomy looks like.
Okay.
Of what this is the regular digestive intestinal system.
Correct.
But one of the first ones that you do is gastric band surgery. And for one, I didn't know there were different types, but there are three different types of surgeries.
Correct. The band procedures are probably the sort of middle kid on the block, if you will. They've been around about 10, 12 years in the United States, a little bit longer in Europe and Australia, and it's just a band is put around the upper part of the stomach. There's a way then we can inflate the band and make it tighter so it sort of tightens around the top of the stomach. Then the little pouch fills up, and that sends signals to your brain that says, oh, I'm not so hungry. So the band allows you to eat less and not be hungry. It doesn't force you to eat less. It's just a helper.
And is this what would you call minimally invasive?
It is the least invasive of all the procedures. When we talk about minimally invasive, we're talking more about laparoscopic, doing it through tiny incisions. Okay. We can do all of these procedures through the minimally invasive approach if that's appropriate.
Are there some that are better suited for people? I mean, how do you decide which is the best for a person?
We sit down and talk to the patients, and each one has some pros and cons. The gastric bypass has been around for 30 years. We know a lot about it. It has the most potential risk, although it's still very low, but it has a really dramatic impact on diabetes. It has the most impact on weight.
And how does that one work? And we're looking at a graphic of that.
You create a small pouch, but you're actually, with our staplers and dividers, we can actually create this, make the stomach into two parts. A little tiny pouch fills up quickly, tells your brain, I'm full. And then we're going to make a connection of the small intestine so the food travels that way. And then downstream we connect back in so the digestive juices come in. But that bypassed part seems to be very instrumental in why we get such a dramatic impact on making type 2 diabetes go away.
Very interesting. And that is obviously a much more major surgery. You're working with more than the stomach there.
We're doing both stomach and small bowel, exactly.
And then the sleeve is the third.
The sleeve, we only operate on the stomach. It is actually, we remove 80% of the stomach, so that the stomach that used to be sort of a big flat bag, if you will, now it becomes just a tube. Again, fills up quickly, so your brain says, okay, I'm not hungry. And also, because of that part of the stomach that is removed makes a hormone that stimulates some of the hunger centers, it makes it so you're less hungry as well.
We have some dramatic before and afters. I can't believe these are the same people, doctor, but you say it almost is a snowball effect. Once someone has this surgery, they are motivated to, take part in exercise that they may not want to do.
It doesn't hurt every time you exercise now, but you don't have to lose 100 pounds. It's amazing. A 15, 20-pound weight loss, and all of a sudden you're not short of breath. You don't hurt every time. So you can go another 5 minutes in your walk. And once people start seeing results, people really do think of this as, this is really my last chance. I need to do this, or I'm not going to be around to see my kids and my grandkids.
You have a seminar, because we've only touched the tip of the iceberg of this, and I know people have questions, so they can get those questions answered. You're going to hold a seminar Wednesday, April 25th. There's the information at Aladdin Shrine Center. The seminar is free. We want to point that out. But you do want people to register so you know how many folks are there.
Exactly.
Very interesting topic. Dr. Choban, it's a pleasure to meet you. Thanks.
Thank you.